A number of Kenyans are feared to have been vaccinated against COVID-19 at unlicensed health facilities, many of whom have had to pay for vaccines that the Ministry of Health has now expressed skepticism towards.
The DCI has moved in some facilities that have been illegally vaccinating people for COVID-19, and chances are that you are not even being vaccinated with proper vaccines. There is every possibility that you are even being vaccinated with water and paying for it.
This comes even as it remains unknown to many on how to identify a legitimate vaccination center.
Nobody is authorized to vaccinate you except for those outlets that have been given authority by the Ministry of Health. And not only have they been given authority by the Ministry of Health, they vaccinate for free.
Even so, hundreds of thousands of Kenyans who have already received their first jab are now awaiting the second dose to complete their immunization against the virus.
At the moment, we are not vaccinating a first dose vaccination. We are only doing the second dose vaccination. But we are confident that in a few weeks, we will be able to roll out not just the first dose, but also the second dose at the same time. But right now, because of supply constraints, we want to deal with the second doses for those who got the first dose.
This comes even as efforts to facilitate mass vaccination of Kenyans continue to be made, with Kenya, on the other hand, set to receive over 300,000 doses of the AstraZeneca vaccine this week from Denmark.
What we are investing in now is actually Johnson & Johnson. And this is something that we expect. Johnson & Johnson is a vaccine that we expect to get perhaps in the next 1 month.
According to the Ministry of Health further, the rare COVID-19 case containing both the UK and Indian variant recently detected in Kisumu is in a stable state.
Kisumu County does have an upsurge, and we have not seen a decline in terms of the positivity rate in Kisumu County and the neighboring counties as well. What we are going to do is to increase the testing. If we expand the testing, we will get the true positivity rate. But what we are saying essentially is that we need to be ready.
This was announced even as the Health Cabinet Secretary Mutahi Kagwe commissioned a clinical waste management equipment at the Kenyatta National Hospital.
When you walk around and you see all sorts of masks disposed all over the place, if we don't invest in the manner that we are investing here, two things are going to happen. We will spend more money and we will get sicker. We are going to reduce the sicknesses that comes out of these carcinogenic materials.
Ben Kirera, K24, Evening Edition.